having 3 chromosomes as a set, as a 3 chromosomes as a set. For example, this is single chromosome is present here. Okay, that is a monoploidy. 2 chromosomes are in paired condition. This is diploid. Here the set number is again increases. That is 3 chromosomes are paired like a set. So that is 3x cell. 3x cell. If it is 4x means in a set 4 chromosomes are united, are paired. So in this way, set number is increased automatically. It indicates polyploidy. It leads to more than 2 sets are there. Definitely it is polyploidy. 3x means that is called triploid, 4x means tetraploid, and 6x means hexaploid. But in the aneuploidy, you are getting the basic set is 2n or 2x. In this set, either 1 or 2 chromosomes or 3 chromosomes sometimes missing. So such type of numerical changes are conferred as aneuploidy. దీన్ని విషమస్థితికాలు అంటాం, దీన్ని సమస్థితికాలు. సమస్థితికాల్లో ఏకస్థితికాలు, ద్వయస్థితికాలు, బహుస్థితికాలు. ఇక్కడ విషమస్థితికాలను మళ్ళీ 2 రకాలుగా వేస్తాం. అధిస్థితికాలు, అల్పస్థితికాలు. అధిస్థితికాలు అంటే ఉండాల్సిన ద్వయస్థితిక క్రోమోజోమ్ల కంటే 1 కానీ 2 కానీ అదనంగా వచ్చి చేరితే దాన్ని మనం అధిస్థితికాలు అంటాం. అల్పస్థితికాలు అంటే డిప్లాయిడ్ సెట్ లోంచి 1 లేదా 2 క్రోమోజోములు మిస్ అయినట్లయితే. So you know very well in most of the competitive examinations it monosomy, that is 2n minus 1, nullisomic 2n minus 2, trisomic condition, that is 2n is a basic number of chromosome, but in addition to the basic, 1 chromosome is appear in thrice. Here also in addition to the basic set, 2 chromosomes are appear in thrice. So that is called tetrasomy, trisomy. These are this numerical notations are asked in the CPGET entrances mostly. 2n minus 1 what, 2n minus 2 what. So this type of condition, how it will be arise. So this condition is arise at the time of cell division, meiosis, due to the non-disjunction of the chromosomes. Non-disjunction. Chromosomal aviyojanam dwara. Non-disjunction is the main reason for this aneuploidy. Non-disjunction means chromosomal, 2n is equal to 10 undanukondi. If 2n is equal to 10, at the time of meiosis, n is equal to 5 gamete is formed here, n is equal to 5 gamete is formed here. But due to the abnormal behavior of the chromosome or any non-disjunction of the chromosome, one of the gamete receive n plus 1 chromosome. One of the gamete receive n plus 1 chromosome. Another gamete it receive n minus 1. What? N minus 1. So this n minus 1 chromosome, n minus 1 gamete fertilized with normal gamete, we are getting what? 2n minus 1. What is that? 2n minus 1. So this type of condition generally we can see in some crop plants, and in the human beings also some genetic disorders we can studied in the zoology subject, that is Turner syndrome, Klinefelter syndrome, Patas syndrome. So many genetic disorders are indicates the aneuploidy conditions. So I think understood the numerical aberrations in chromosome, euploidy and aneuploidy. So once we can go for some examples, and after the example I will conclude this session. Euploidy, I am already said, exact multiple basic chromosome number. So euploids can be monoploids, diploids, and polyploids. Monoploid everyone knows. Common wheat possess monoploids. So these are the different type of already polyploid again divided into autopolyploids and allopolyploids. So before going to that, we can explain about some genetic disorders. This is 2n minus 1. The best example is Turner syndrome. Here female with retarded sexual development who is usually sterile. So one X chromosome is absent. So that is called 44 plus XO it is donated by. Nullisomic, diploid organism which have lost a pair of homologous chromosomes are called nullisomic. So humans with this condition will not survive 2n-2 condition. So hyperploid, adisthitikalu. Trisomy 2n+1, it represented A.F. Blacksley and his co-workers in Datura stramonium first time. In the 4 homologous tends to form a quadrivalent at meiosis. Disjunction often proceeds fairly regularly. So all the 21 possible tetrasomics in wheat also identified. So these are the trisomic conditions, example, Patas syndrome, Edwards syndrome, Down syndrome. Down syndrome is 21st chromosome appear in thrice. 18th chromosome appear in thrice. 13th chromosome appears in thrice. So that is nothing but is called trisomy, 2n+1. Okay. So chromosomal complements. So these are the photographs related to the symptoms. Trisomy, Edwards syndromes, Down syndrome. So these are all things you already studied in the zoology. Klinefelter syndrome. An extra X chromosome is present in the males. That indicates female sexual secondary characters are seen in the males. So due to this type of syndrome. So about this, I thank you for this patience listening the class.
Thank you very much, sir. Bhageerath sir. Regarding of this class, if you have any doubt, please ask our respected sir. పూజ గారు, అదేవిధంగా రోజా, రాకేష్, హరీష్, మీకు ఏదైనా డౌట్ ఉంటే ఇందులో అడగచ్చు. సారు మనకి డౌట్స్ క్లారిఫై చేస్తారు. అదర్వైజ్ ఐ విల్ గోయింగ్ టు వైండ్ అప్ ద సెషన్స్. సో సార్ ఇస్ క్లియర్లీ ఎక్స్ప్లెయిన్డ్ అబౌట్ ది chromosomal aberrations, numerical aberrations, and the structural changes, aberrations, chromosome structural changes, and numerical changes. Which type of aberrations, which type of chromosomal aberrations we are observed. Sir has clearly explained, including the examples also sir has clearly explained due to the aneuploidy, trisomy or monosomy, different types of the genetic disorders, that is syndromes, sir has quoted. And also sir has clearly explained the homologous chromosomes and the monosomy, monosomy, and also the trisomy, and the monoploidy, diploidy, and polyploidy also sir has clearly explained. So my dear friends, thank you very much, Dr. Gogikar Bhageerath sir. I will go into wind up the session. Thank you, sir.
Thank you, sir. Thank you.